Good evening, and thank you for joining us for the National Health Service Corps' 2012 webinar series. Tonight's webinar is Motivational Interviewing, presented by Kelly Gannon. Ms. Gannon is the Chief Operating Officer of 7 County Services, a large community health center located in Louisville, Kentucky. She has worked in behavioral health for over 20 years and earned her master's degree in social work from the University of Kentucky. The goal of tonight's webinar is to provide health professionals with the opportunity to enhance their motivational interviewing skills and better understand the benefits of motivational interviewing. NHSC is pleased to offer continuing education credits of 1.5 hours for all disciplines participating in this webinar. To receive credits, you must attend the full 1.5-hour session. Attendance will be verified throughout the webinar with polling questions. You must respond to all the online poll questions, and once you respond, your attendance will be noted. At the conclusion of the presentation, the operator will provide instructions on how to submit a question through the conference bridge line. You can also type a question on the screen at any time. There will also be an evaluation after the Q&A session. We would greatly appreciate it if you took a few minutes to fill out the evaluation so we can continue to improve our future sessions. Thank you again for joining the 2012 NHSC webinar series. We hope you find this webinar useful in providing service in your community. Now please welcome Kelly Gannon.
Thank you, Barbara, very much, and I'm happy to be with you this evening to share with you some exciting things about motivational interviewing. So we're in for a very fun, I think, and possibly interactive webinar on motivational interviewing. This is probably the second or third webinar I have participated in, and the more that we can interact as we go along, the better. So let's get started. The best place to start with talking about motivational interviewing is to start with a definition. Very simply, and we'll go through this piece by piece, but it's a directive, client-centered counseling approach or counseling style. And the thing that I think is very important about what I need to say here is that it's a style, not necessarily an intervention like cognitive behavioral therapy might be, but it's a style choice that we make as practitioners. What we want to do is not just be client-centered like with Rogers or Rogerian, but also to be directive. And I think that's what really separates motivational interviewing from just the Rogerian viewpoint. And that is that there is a point in time where it can become directive. So it's a directive, client-centered counseling style. And again, when you're talking about style, it's not going to fit everybody. So I hope as we go through this and we learn a little bit more about what motivational interviewing is all about, you'll find out whether or not that style might fit you. So it's always about helping clients explore and resolve. Or if we do anything with motivational interviewing, it's about looking into exploring. So our questions are about how do we help the person explore and resolve ambivalence. Ambivalence is key to motivational interviewing. Everybody that we encounter, that we work with, that comes in contact with us in whatever professional setting that we're in, has our clients have ambivalence about the behavior change. And the best thing, and we'll get into this quite a bit as we go along, is that ambivalence is ours to help bring to the surface so they can begin to explore behavior change. So, to repeat, motivational interviewing is a directive, client-centered counseling style for helping clients explore and resolve ambivalence about behavior change. So, what are some of the benefits of motivational interviewing? And let me pause and say here that motivational interviewing got its start in substance abuse work or addiction work. And it has slowly made its way into other realms like behavioral health. It's working really well right now with people who are being diagnosed with diabetes and people who want to quit smoking, people who have other illnesses like SPMI or severe and persistent mental illness. So motivational interviewing has begun to broaden its approach to just about anything that requires behavior change. So some of the benefits. First thing, MI increases treatment retention. I always say that I'd much rather be able to work with someone who's going to come back and work with me than come at them in an approach that says behavior change has to happen now. So MI increases the opportunity for me to continue to work with someone. MI also increases treatment adherence. So if homework is given out, or if medication is the desired piece, or exercise, or whatever it might be, treatment adherence is also improved. MI increases job satisfaction, our job satisfaction. We all know how difficult it can be to work with people who are struggling with trying to make behavior change in their lives. So MI, using that style, can really increase your job satisfaction. Along with that, then, it decreases staff burnout. I have been, like Barbara said, in the field for over 20 years. I started out in the addictions field. I worked my way into working with people, adults with mental illness. I've worked with children. I've worked with families. And I tell you what, it really does, using the style of motivational interviewing, does decrease my cynicism and my burnout. I also am a LCSW supervisor that helps people reach their licensure, and I talk a lot about how MI really helps you with all the difficulties in working with folks. So MI works concurrently with other approaches, and that's the other thing that I really love about MI, is that it's really the foundation or the style that I use that directs everything that I do, but then I can use it concurrently with CBT, with PCIT, with some of these really great approaches out there. Okay, so let's get into the things that we're going to cover in this hour. First of all, the general principles. This is just a quick overview, but these general principles are fundamental to motivational interviewing. Number one, reflective listening, and we're probably all very familiar with what reflective listening is and how it can be applied. What MI does is they really teach you about timing. They really teach you about what it is you're trying to accomplish when you actually apply the reflective listening. It's not just about saying, I heard you, I understand. It's also about how can I help this person resolve the ambivalence that they're having right now. So we'll go into that in some detail. Develop discrepancy. We all probably understand this concept pretty well in our own lives, and how we feel two ways about something. In any behavior change, from changing the way we eat, our diet, to our exercise routine. We can tell anybody who might ask us the difficulties we're having in making that change and the pros and cons of each side. But because it's us, we may not recognize that that's what we're saying and doing. So that's what it is. That's my job as a counselor. When I'm hearing someone speak to me and I hear the discrepancy and they don't, that I help them develop that discrepancy. Okay. And here's one of the more controversial things I think with motivational interviewing is people go, well, how can it work if you're not going to actually directly confront the issue at hand? Especially when someone says to you that, well, I don't want to change, I don't think I need to change, and I don't need to be here. How do you avoid direct confrontation? Well, we'll talk about that a little bit. That is essential with rolling with resistance as well, that we need to do. And that is, when resistance comes up, it's actually a key to the therapist that you're the one who needs to change your approach. Not that the client needs to change what they're doing. We'll talk about that. And then support self-efficacy. A lot of times we forget that our clients are the ones who know the answers to their own questions. And we really need to to work on supporting that. And that's what reflective listening does as well, is help us support that self-efficacy. We'll go into that as well. So that's just an overview of the general principles of motivational interviewing. So principle number 1, let's get into reflective listening. Like I said, reflective listening is not just about, oh, I heard you, I'm listening, I got it. It's also about facilitating change. And so you're very timely in the way that you use your reflections. Skillful reflective listening is essential to raising client awareness. You use your reflective listening points and skills to say, not only did I hear you, but did you hear yourself? So the better you get at being a reflective listener, the more you'll be able to raise awareness for your client. It does build the working alliance, and that's essential. And a lot of people that I've worked with, staff people and LCSWs and so forth, really have good skills related to building that working alliance. So the reflective listening skills are there. It's just a matter of heightening them and becoming better at it with your timing around it and what you're looking for to reflect. And I think that's exactly what motivational interviewing teaches us to do. What is it exactly that I need to pick out of what they just said to reflect back? It also demonstrates that I'm coming alongside the client. I'm really listening. I'm really hearing your story, and I'm not putting my judgments or anybody else's judgments, like society's judgments, into their story. I'm actually coming alongside to seek to understand. It shows interest. I'm showing that I am interested in their side of the story. I'm interested in helping them, and it really builds that alliance. It helps me follow the client's story. If I'm focused on doing some reflective listening, then I'm really following that client's story, and I'm not doing my own thinking in my own head about where do I need to go next? Where's my agenda is I need to get to this place with this client. If I'm doing reflective listening, the chatter in my head about where I should go next with this client is shut down because I know exactly where I need to go because they're leading me in that direction. Okay, so let's just kind of put together what a reflection might look like. It's a hypothesis. It's an actual guess about what the speaker is meaning. So if someone says to you, you know, I've had a really tough, hard, long day, you might reflect back to them that they're really feeling wore out tonight. So you might put into that particular meaning that they're wore out. And it's still a guess. And you want to have them to have time to react to what you've done to imply meaning into this reflection. And then sometimes you're right and sometimes you're wrong. What I like about it is when I'm wrong, they tell me, and it's okay, and I go, gotcha, missed that, so now I know what you mean. So that's another good tool for reflective listening. A statement is to convey understanding. At least, am I getting this right? Am I following you the way I think I should? Your intonation should be down. If you're doing a reflection, it's not a question, it's an actual statement, and you allow the people that you are working with to respond and to react to your implication in the meeting. So, for instance, you might start your reflections with really short stems like, so you'll know you're doing it right if you go, sounds like you're having a tough day. So, this has been difficult for you. Seems like you're really struggling. You feel overwhelmed. So you see how those kind of start versus saying something like, so you're really having a difficult time? Or so you're really angry with your mother? Something like that. You don't. That's not a reflection. That's a question, and it's a yes or no question. Hope this is making sense. I don't see any questions at this point, so I'm going to keep trudging forward. But if you have any, please let me know. All right, there's two types of reflections that we use in motivational interviewing. The first one is a simple reflection, and it's the one that actually conveys the understanding, follows the story, builds the alliance. That's what simple reflections do. What complex reflections do, which we'll get into in a minute, they're the ones who actually develop the discrepancy and help you resolve the ambivalence with your client. So the simple ones is you repeat an element of what the client has said. So if the client comes in and starts describing their day or starts describing an interaction they had out in the hallway or talking about their job or whatever it might be, or even the exact problem that they're trying to focus on with you, then you just repeat an element to say, yep, I'm following along, I'm getting this, I got it. That's going to help build the alliance. So you just repeat a simple element. Rephrasing is that you stay close to what the client has said, but you substitute words or you rephrase what was said. So again, you're still listening but you're just applying a little bit more meaning to what might be going on. Like if someone says, well, I don't know, today's been tough, and then they describe a few things and you use the word overwhelmed, it's just another way of saying, oh, yeah, I think it is. I'm kind of overwhelmed. I've got too many, or you use a metaphor and you might say you're juggling a lot of things in the air. Again, these are very simple just to build alliance. Now the complex reflections. So the therapist actually implies the meaning in what was said and reflects it back to the client. So sometimes we have clients, like I said, let me go back for a second, because motivational interviewing is about helping someone who actually needs to resolve that ambivalence and develop that discrepancy. And as I said earlier, not everybody is always aware of their own discrepancies. So, and the fact that we can talk just right out right now and not even hear ourselves say these discrepancies. So when you're paraphrasing and you imply meaning in what is said and you reflect it back to the client, this is when you're really trying to develop discrepancy. So if you hear it and you know they didn't hear it, then that's the opportunity to reflect it back. So as an example that might help here to establish this, I'll share with you just briefly about a client that I worked with who came into the first session and told me that she had just finished going through medical detox and was now off morphine for the first time in 25 years. And she wanted to stay off that morphine. And as we talked over the next 15, 20, 30 minutes, what I learned from her is that she wanted to stay off that drug, but she wanted to continue to smoke pot. Okay? Now, what do I know as a therapist, and what many of you are probably thinking right now as well? I know that marijuana is likely to lead her back to her morphine use, right? So I had to, sorry, I keep going black there, okay. So what I had to do was really listen to her story. I had a chance to really work with this woman, or I could say, well, now you know that's going to be really difficult to smoke pot and not go back to morphine. The thing is, she already knows that. So it's my job to reflect back what I've heard. So I said simply to her that she really wants, so I said, what I'm hearing you say is that you really, really want to get off the morphine because you really see the problems it gives you and it causes you. Over here, though, you have marijuana, which doesn't cause you any problems, and you would like to continue to smoke marijuana but not do your morphine. And she said yes. I then was able to ask, well, how is that going to work? I put it back on her to answer the question. How does that work? How does one continue to smoke pot and not do morphine? We were able to have a conversation. So I hope that makes sense. So we're implying the meaning in what was said and reflect it back to the client. I implied to her that that might be a difficult thing. Tell me how that's going to work. All right. Another thing is reflection of feelings. A lot of times when I'm working with folks, they don't know how to label their feelings. And they'll dance all around it. So a reflection of feeling is when someone's saying, I just don't know what to do, this is a struggle, but they're not saying words like, I'm sad, I'm angry, I'm hurt, I'm overwhelmed. Reflection of a feeling can be very powerful in helping someone understand and really connect with something that they have not connected with before. And it's that discrepancy where they're saying, wow, I never knew that I felt that way until you said that. Some of you may have had an experience like that when you've said something and you've reflected something and a client goes, yeah, oh my gosh, I never thought of it that way. That's what this reflection of feelings is all about. Metaphors. Metaphors are powerful because it's able to distance the client from their the feelings that they might have that might be too difficult for them to actually experience. And if we talk about things in metaphors, it's just easier to do that. So I find them to be very, very powerful, and they're complex reflections about helping someone develop discrepancy really well. So again, I hope I've explained well that there are simple reflections, and I think we all kind of innately carry some of those, that skill level, but the complex is more about the actual timing around, hey, I heard a discrepancy, or I hear the ambivalence in what they're talking about, and it's my job to elevate it to a level that they can talk about it. Excuse me for a second, because doing all this talking by myself, I need something to drink. Thank you. All right, so let's go on to principle 2. Develop discrepancy. Okay, discrepancy between what it is it's between present behavior and important goals for the future will motivate change. That's what discrepancy will do for us. So 2 things out of this that I need to know is, what are you doing today that does not fit into your ultimate goal for behavior change? And I say this as simply as, if I'm working with a woman who comes in and says, I really want to not hear the voices in my head anymore. But she says to us, but I don't want to take that medication because of the side effects. So what I need to look at is, how do we bring the 2 together, that she wants to stay off the, not hear the voices and not take the medication. How do we bring those 2 together so we can motivate change? That's why it's always, always important that when I work with someone, the first thing that I ask them is what's their goal? What is the goal? If I don't have that, then I have nothing to refer back to, and I'm not going to be able to develop the discrepancy that the client needs. So always start with what their goal is. And believe me, I've worked with very different goals, from I don't want to be on morphine, but I want to smoke pot, to I want my baby back that DCBS took from me, child agency took from me, to I just want my probation officer off my back. Great. If that's your goal, I want to help you reach that. What's it going to take to get us to help you to reach that goal? Many times, clients' goals do not match my goals, or what I would see, or what an agency might see as what is needed in order to help this person get better. But their get better might be different than mine. So again, the first thing, 2 things out of this. First thing, you need to know what the goal is, and you need to know what their present behavior is doing to either hurt that goal, accomplish that goal. Next thing, identify the ambivalence to raise the awareness. Motivational interviewing is just there to help raise awareness, so they do all of the talking, they do all of the arguing of the both sides. It's not my job to be the expert and land on one side to help them understand or to educate them on what is not good about their present behavior or how they need to change. When the ambivalence is identified, I'm raising their awareness so that they can do the arguing for change. We'll talk a little bit more about that in a minute. All right, we invite the client to present the arguments for change. I just said that. That's exactly what we need to move into. It's just, if I've got the client going, on the one hand, I'm doing this, and on the other hand, I want to do this, how do I make it work? Then I'm doing my job with MI. We always should separate the behavior from the person. This is not about when we're working with someone, I'm not working with an addict, or I'm not working with someone with mental illness, that is schizophrenic. I'm working with someone who suffers from a mental illness. So we always got to be very diligent about that. All right, so here's how to develop discrepancy. The best way is to use reflections. First, we would use a very simple strategic reflection called double-sided. And I've already kind of demonstrated that a little bit and even used my hands to do that, which is on one hand you're saying this, but on the other hand you're doing this. Let me give you an example. I worked with a lot of women who had to see me and were sent and referred to me by a court order because when they went in to deliver, their baby tested positive and their baby was removed, and they were given a caseworker immediately, and I started working with them to help them get their baby back. Well, the number one thing that the referring social worker wants is that they quit using and have clean urine screens. Part of that, then, if they do that and they're successful, they can get their child back. And every single woman that came in to see me would say to me, yes, Kelly, that's my goal, is to get my child back. And then I would go into, so what is it going to take to get there? And I remember one woman in particular who said, I don't have a problem not using drugs, and that's not going to be a problem. The biggest problem for me is that they want me to stop hanging out with my boyfriend or the baby's father. And I'm going to have a hard time doing that. So when she came in and we were talking, she told me about her weekend, and I was able to use a double-sided reflection because I had a very clear goal that she gave me from the first session, which is she wants her baby back. So I said, so if I understand this right, and what I'm hearing you say to me is that you really want to have this relationship with your newborn daughter, yet you're still finding it very difficult to stay away from the baby's father. And she says yes, because she had just told me about visiting with him, and then I allowed her to go on with the argument, to say, yes, this is what I'm doing, this is how I'm struggling. It really opened up the conversation to a point where she was then arguing her own problems with this behavior change. I'd like to say that this worked out perfectly and she gets her child back and all of that, but sometimes some people aren't ready to change even when they recognize and have awareness around this. But that was my job. I helped raise that awareness, and she was able to argue why she needed to change and why it was difficult for her to do so. All right, so that's a double-sided. Turn up the volume to help develop discrepancy is with an amplified reflection. So we might say something like this. If someone come in and said, well, it's no big deal. So what, I hung out with him, I'm not going to get caught, and it's no big deal. So you might say something back as a reflection, so you really don't care what happens if you get caught. And they're like, well, no, I'm pretty sure I'm not going to get caught. And they just kind of react to that and like, oh, wait a minute, am I saying that? So you kind of amplify what the bottom line, well, I mean, not the bottom line, but what the actual behavior change might become if they don't intervene and they don't change. So you turn up the volume of the reaction or the consequence and have them react to it. And go, yeah, I guess, I really didn't think I was saying that, but now that you say that, I think I am, and I need to look at that. So turning up the volume. Pros and cons. One of the best things you can do is, okay, let's just look at it here. Let's list the pros and cons. And that's what I did with this young lady as well. As I listed, what are the pros that are continuing to hang out with the father, and what are the cons to hang out with the father. And she labeled all of them. I didn't have to do any of the work. I just helped guide her. And in the end, she knew what she needed to do, and it was a matter of choice whether she did it or not. And in this particular case, like I said, she didn't do it. But in other cases, like the woman that I worked with that wanted to smoke pot, we got to a place where she was able to say, I can't do this, it's not going to be successful, and if I don't make a change, not only in this area, but in the area of smoking pot, then I'm not going to be able to make it. You want clients saying, I'm not going to be able to make it. You don't want to be the one who says, you're not going to be able to do this if you don't do this particular change. So pros and cons, very powerful use for developing discrepancy. Okay, we're on principle 3, avoiding direct confrontation. And I think, like I said earlier, that this one can be a little difficult for folks because sometimes people so blatantly say things that we go, you know, did you hear what you just said? And can you really think that you're going to be able to do that? Or like, for instance, I've been told at least 100 times, if not more, that the only reason they tested positive for drugs in their urine screen was because they were hanging out with somebody who was using, and maybe they inhaled smoke, or, and you know, my expert in me says, yeah, you know, you can't test positive for that, and that's going to be a really difficult thing, and so, you know, that's my instincts to do that. But usually what happens is if I start taking that stance and telling them, well, if you just change your diet this way, or if you don't hang out with people who smoke pot, or if you just start doing this, what happens is they start justifying it. And they start getting on the side of one side of the fence, and I'm on the other, and we're what we're calling wrestling rather than dancing, and we're wrestling around who's right, who's making the most sense, and all of that. And it's not productive, and I can lose a lot of people in the rapport that way if I start arguing on one side of the fence. So that's resistance, and that's what I've got here. Resistance is a signal to me, and not the client, but to me, to change my strategy. And believe me, I've been practicing motivational interviewing now for 15 years. And I'll get into a really good session with someone, and you know, midway through the session, I'll find myself, oh, wait a minute, there's some resistance there. And I now have been able to go, okay, what am I doing that's getting in the way and creating some of this resistance? And it's my signal that I need to change my strategy and back up and go, how can I get back into some reflections so that the client doesn't feel threatened by what I'm saying? So it can still happen. It's very difficult not to get into that place where you feel like you're trying to convince or and give good advice, or what if some of the other things that we feel like are helpful things actually turned out to be not so helpful. So if I put a client in a position where they feel like they have to defend their position, it's just going to breed defensiveness. And I know all of us can probably count on recount a time when we were working with clients where that's exactly what happened. Is that they were defending, and it just bred the defensiveness, and we lost. And you know what happens is that the client just doesn't come back to treatment. And if you remember from the beginning, MI, one of the things that it does is help us and the client with retention. And what I find is I have more to work with if you're showing up, but if I lose you after the first session because I didn't change strategies and I was trying to argue and take the expert stance on the behavior changes that you needed to make, then I have nothing to work with if you don't come back. So I really appreciate MI for that people keep coming back, and we keep having something to work with. So again, principle 3 with avoiding direct confrontation is that we want to avoid getting into those arguments. And when I say arguments, I don't mean that you're going back and forth with a client, but there is a banter I think we can get into with clients that's unproductive. That, you know, neither person is hurt by it because it's not personal, but we're definitely arguing strategies or arguing behaviors, and we're really not being productive for the client or for ourselves in that situation. Okay, and this is one of the things that I really appreciate. And when I said, when I get stuck and it's my turn or my signal that I need to change strategies, uh, I like to think of the fact that I can get out my oars and start over. So if I'm stuck, get out your oars. And this is what oars are all about. You start with open questions. So you start with something like, describe to me, tell me more about that. Tell me what I missed there. Tell me what I'm not understanding. Tell me more. Or describe to me what that might be, that experience was like for you. I wasn't there, I don't know, or whatever, but describe to me. Or if you're really just trying to understand for the first time what someone's going through and you're meeting them for the first time and they're trying to tell you what their problems are, and there's a real difficulty in focusing on that, you might say, well, tell me about a typical day. Describe a typical day to me so that I can understand from your perspective as you're going through the day how this particular problem affects your day. So we call that typical day. And it's a great opening question for anybody that you are seeing for the first time. But open questions will always take me back out of that place where I might be arguing with a client. Affirmations. I think sometimes we forget to give those affirmations. And affirmations should be what we call labeled. You don't want to say, glad you're here. Instead, you want to say, good for you for showing up today, because I know that being here isn't what you like to do, but you showed up today, and that's progress towards your goal to get your probation officer off your back. So actually label what you're affirming. Some of you may be familiar with parent-child interaction therapy, and part of the pride skills there is to do labeled praise. And that's the same thing here. You really want to label exactly what you're praising. And it's good. It's just always good for people to hear affirmations about themselves and how they're doing. Okay, we talked about reflections. It's what I do the most. If I were to do a session right now and show you some of the skills and just kind of do a 5-minute walkthrough with a client and using my motivational interviewing skills, 90% of what I do would be reflections. Which means that I'm not even asking questions to lead them in any direction. I'm just reflecting what they're giving me, and we're making progress, and I'm raising awareness, and I'm helping them resolve that ambivalence. Again, that's the whole focus of motivational interviewing, raising the awareness of the ambivalence and resolving the discrepancies. So reflections do that. 90%. That's all I need really is the the reflections. And then a summarize. Summarize is the best tool for me to actually get out of that stuck place. So when I find myself with a client and I'm like, I don't know what to do next. I don't know what good open questions to ask. I'm just lost and I feel like we're in an impasse and I really don't know what to do. Then summarizing really helps. And it's actually a reflection, but it just goes larger than just a simple or complex reflection. It actually summarizes to where you all are to that point. So you might say, so we've talked about these 3 issues, and now we're at a place where we don't know which out of the 3 is the best place to go. So I heard you say this, this, and this about these 3 things. Where do you want to go from here? So that's what a summary would do, is you summarize where you are, and then you ask a question about, okay, what's next steps? And you ask them to lead you to the next step. Sometimes you get it right, sometimes you don't, and that's okay. But summary can really, it will move the session along at least, especially if you feel like you're stuck. It has worked for me every time. So again, when you're stuck, get out your oars. All right, this is a little bit more about summary that I just talked about. So set up your statement. Let me see if I have this right. Let me tell you where I think we are right now. Or where does this leave us? Where are we? Where else do we need to go now? I know for me that sometimes I'll get people that come into a session with me and they want to throw up. They just want to say, here's what's going on, blah, there it is. And usually they'll say, wow, I feel better, because they've just taken all of that emotional garbage and let go of it. Well, after they do that, then it's like, okay, well, where do we go from here? And I use summary a lot to help generate the next part of the session after they've regurgitated their emotional baggage. So I'll summarize all of it, and then I'll say, where does this leave us? Where do we want to go with the next 20 minutes, 30 minutes, whatever you got left, to help you resolve these issues, or to help, what's the goal of the session today? And it just helps get things really focused. So I usually don't wait 30 minutes for that to happen. I'll usually give someone a good 5 minutes. I used to wait 30 minutes, but now I give them a good 5 minutes to just let that release happen, because that is important, I think. And then we summarize and move forward. When people are asked direct questions like that, I think it's very easy for them to move forward after that. But if we just allow it to go on, it will. That's what will happen. Okay, principle 4. I'm going to take another break here. Right. Is rolling with the resistance. I think sometimes when I'm in a live presentation, I'll sometimes get pushback on this, where people go, you know, resistance is natural, and I think an appropriate part of what we do when we're working with people. But a lot of people, and this is where the style piece comes in, where you go, okay, this may not be for me. That motivational interviewing as a style may not be working for me. And that's okay. In fact, if you recognize that about yourself, I think that's great, because you don't want to be using a particular practice or approach to therapy in a way that's not going to be comfortable for you. So this is where I think this principle is what makes or breaks some people around using MI or not. So let me just get all these on here. Okay, so we want to avoid that arguing for change. I think I've summed that up pretty nicely for you so far, that it gets us nowhere, and it's only going to breed defensiveness in the client, and most of the time the client won't come back because they don't find working with us very useful in that way. New perspectives and information are invited, but not imposed. So anytime I've wanted to maybe give information or provide information, it's always invited. Would you be willing to hear some feedback? Or would you be willing to hear some information about a parenting class? Or would you be willing? I always ask for the invitation to do that, rather than just naturally impose it on them. People find that to be very nice. They like the idea of being asked if the advice can be given, and they're more likely to receive it better if you ask to be invited to give that. However, I don't give much advice if I'm practicing motivational interviewing, because, and then this next bullet point emphasizes this, that the client is the most valuable resource in finding solutions to their problems. If you ask me about any of my problems, and you ask me to tell you what my problem is with the problem, like say for exercise, for example, and why I have a hard time getting motivated and that sort of thing, then I can tell you both sides of the equation. I can tell you why I need to do it, and I can tell you why I don't. I can tell you why it's good for me, and I can tell you why I still lack the motivation to do it. Even though a client may not give you that information, it's inside of them as well. So just like the client I was working with, who wanted to continue to hang out with the baby's father, but also knew that if she did that she would have a difficult time getting her child back. She could argue the pros and cons of hanging out with that father. She didn't need me to tell her what she should and shouldn't be doing around that. And again, motivational interviewing is designed to help me help her raise that awareness so she can resolve the ambivalence around it. So let's not forget that the client is the most valuable resource in finding solutions to their problems. And then use your ORs. So this is how you roll resistance. First, you avoid arguing, you step back, and you use your oars if you find yourself arguing. You constantly look for the client to provide the solution, and you ask for new perspectives to be invited. You don't impose it. Okay. This is the part as well, like I said, that separates people from, do I really want to use motivational interviewing or not? And that is, I really think MI forces us to look at ourselves. What am I doing to contribute to this process with this client? What do I need to do different when a signal goes up that I'm seeing some resistance in this client? And so this is what gets in the way, I think. This is what breeds defensiveness. This is what creates some problems, I think, in the therapeutic relationship. And that is the therapist roadblocks. This is how we get in the way. First thing that we do is that we have premature problem solving. I usually, when I'm in a live seminar, say, raise your hand if you've ever done that. And everybody raises their hand. Part of that is because we've been trained that way. That isn't that my job? I want to help and I want to be helpful, and so I want to help people solve their problems. But a lot of times we're guilty of prematurely jumping in there too quickly when someone's just not ready to hear it the way that will be useful to them. You've probably been on the receiving end of that, where someone's tried to prematurely problem solve with you. And so you understand that frustration and that problems and the defensiveness that it breeds in you. All of this is very relatable, I think, and I try as often as I can to put myself in that client's position. And absolutely, I can understand when anybody's tried to move me from one place too quickly to, going, okay, this is what you need to do. I've been very resistant and given many reasons why I'm not going to do that. So we're guilty of that, most definitely, premature problem solving. Another thing that I think we do is that we get logical with our client, because isn't it logical that if you do A, then B is going to happen? And shouldn't we all just know that? And if we follow that, then we should be okay, because A equals B, and of course I don't want B, so I'm going to do C, whatever it might be. One of the things that I always say here is that has anybody ever been driving down the road in front of a hospital and seen the nurses on the sidewalk smoking cigarettes? Yes, you probably have. And do you think if you stopped your car and went up to that nurse and started being logical with her about her smoking, that would change your behavior? Well, absolutely not. Logic is not a motivator for change. And it hasn't been, and it won't be. And as soon as I try to start being logical with my client is when I start breeding that defensiveness from them and creating a roadblock for us to move together and forward. I've mentioned this one, expert stance. It's easy to jump right into that because, again, we want to be helpful. We want to make sure that people are getting the right education, that they understand things that they haven't understood before. And if I know that and I have that information, then I should impart that to them. But with MI, it's very very difficult for people to really, sorry, I lost my train of thought there for just a second, for to hear that expert stance. Really, really difficult. So, and I don't want to hear it usually when I'm going to people either. I'm wanting to say, listen to me first. Hear what I'm struggling with. Let me know that you're actually hearing me before you start telling me what I need to do. Makes sense, doesn't it? So that's one way we can elicit the defensiveness that we don't want to. We get in our way of the therapy. All right, another thing we do is that we forget that the client is there, and we don't elicit client ideas about change because we think, or we forget that they're their own expert. I am my own expert on me. I know what works for me. And if you get that out of me and you're trying to work towards behavior change with me, then you got to treat me like that unique individual that I am. So I always want to be asked, what do I think I should do? What have I done in the past that's worked? And what have I done that didn't work? That is so important. And I want to know from a client immediately what worked and what didn't. So sometimes we forget to elicit client ideas. And then the client starts feeling like we're preaching to them or becoming too much of a dominating the conversation and saying this is what you should do, and back to the expert, and we just forget to elicit what ideas from them. I usually at this time would say raise your hand if you have ever been in a situation where you really struggling with, can this client really change? I don't know about you, but when I've come into work before, I've had a list of clients that I'm going to see that day just right in front of me, and I'll go down the list and I'll see that one and I'll go, oh, not her. Yeah, it gets tough. It is hard work to stay on top of our game when we're working with people who don't change immediately, who, when we see them, we just know exactly what they need to do and they don't change. So if you stop believing that someone can change, you're not going to be very helpful. And I've been in that situation where I've stopped believing, and it shows. It shows. You don't want it to, and you do your best and everything, but it's reality. But MI changes that. So let me give you an example. I was working with a lady who was pregnant for the 4th time. And she had an 8-year-old daughter, that was her oldest, and her 2 other children had been removed, and they were living with their father, their separate fathers. And this was her 4th child by a 4th man. And she comes in and she tells me that she's pregnant again, and she needs to make a decision about what to do. And for her, she felt like she had 3 options. One was to abort. 2 was to keep the child, and 3 was to deliver and let the baby be adopted. So things were going along well. Felt like, 3 options, that's good. She knows what she's talking about. She's thinking about this. And then the next thing she says to me is, so I've decided to let my 8-year-old decide. I'm going to let my 8-year-old decide what I should do. You're probably reacting right now like I did, which was, oh my gosh, you can't let an 8-year-old make an adult decision like that. My first thing was, this woman's never going to change. She's never going to, I think my heart sunk. My face probably showed some reaction of just going, we can't do this. We can't keep doing this. So everything in me, all of my therapist roadblocks wanted to jump in and just take care of that. Instead, I reflected. And what I said to her was, so let me understand. You understand that you have really 3 solid options that you can make, 3 decision points. And for you, you believe that the best person to make that decision is your 8-year-old daughter. And she goes, well, I think she should have a say in it. I said, okay. That's different than her making the decision. So let's talk about that. And it kept us moving in the conversation. And it got to a place where she said, that's wrong of me to put all of that on her. So just an example of, even though we don't believe a client can change, if we pull out our oars and pull out of our reflexive listening, it can get us to a place where the client is the one making the argument for why they should do something different. That time it worked. Confrontational, and I don't mean confrontational in a way that, that you're arguing back and forth, but basically you take the expert stance, or you take these other things and problem solving and becoming logical and all that with your client. And basically what that turns is into a confrontational moment. And it's kind of what MI calls, you start wrestling with your client instead of dancing. And we all know what that looks like. You know, wrestling, you're throwing one thing one way, they're throwing a thing, an arm another way. But when you're dancing, you're moving with. And it's a great metaphor for me to look at. And when I'm with clients and I'm talking with them and the resistance comes up, I go, oh no, we're wrestling. What do I need to do different? So a lot of these things just can turn into an argument and confrontation. Again, along with not believing the client can change, then you become frustrated when they don't change. I've worked, excuse me, with many people for many years, and it took them a long time to change, but eventually they did. In particular, the woman who came in and said, I want to be off morphine, but I want to continue to smoke pot. She entered and left treatment with me 3 different times over three years. But each time she was ready to tackle that next step in her recovery, she came back to me. And I really believe that's because I accepted her every time right where she was. And that I always helped her I always elicited from her the arguments for change and never imparted to her what I thought she should do. And in the end, she stayed clean. Again, I think if I didn't use MI, she never would have come back after that first session, because if I didn't use MI and I just maintained my expert stance as an addiction professional, I would have said there's no way that you can smoke pot and not go back to morphine. And she wouldn't have come back to the next session. So that alone for me, this happened many years ago, was key to my acceptance of motivational interviewing as a key thing to help people accomplish change. But again, I have to be very cognizant of the fact that people don't change on my time schedule. I hope as I'm describing these things and you're hearing some of these stories that you're seeing the MI benefits that I talked about in the beginning, which really emphasize how my cynicism and my burnout are decreased, because what I see when I'm working with clients is that I'm really helping them resolve this ambivalence about change. And whether they change or not, I'm also helping them look at themselves in a way they never have before. So at least they're armed with the right information. Whether they choose to make that next step and change or not, I can't predict. But they can talk intelligently about what it takes for them to get past that hurdle if they choose to. All right. Next. Okay, so principle 5, we want to support self-efficacy. Let me get all these up here. So we have to believe in the possibility of change for everybody. It is an important motivator. If I believe you can change and I have that type of optimism in my interactions with you, that's going to say a lot and go a long way. So belief in the possibility of change is an important motivator. We talk about, when I'm working with supervisees, I talk about pathological optimism. I have to be pathologically optimistic. So when I look down that list of folks that I'm going to see that day, that it doesn't matter whose name is on that list, I'm optimistic that all of them can change. The client is responsible for choosing and carrying out personal change. This is that piece where I go, okay, I'm going to do my best MI, and I have to remember that even if I do my best MI, not everybody's going to change. Not everybody's going to benefit from this. Even if I'm not doing my best MI, some people will change and some people won't. And I just got to remember that they have to carry out the personal change, and it's not up to me. No matter my best efforts, some people just are not going to change and make those changes in their life. I got to remember to praise accomplishments. I have to affirm. I have to praise their strengths. One of the questions that I like to ask when they identify a problem is, so tell me a little bit more about when you were at your best with this problem. So if the problem's depression, tell me about when you were dealing with your depression at your best. What was it that you were doing to make this work for you? So then I'm able to identify with them what their strengths are, and I can praise those and use those when they're talking about their goals. So very good stuff there when I'm doing that. I have to express my belief and hope that they can change. So the young woman who wants to let the 8-year-old decide, that was a tough one, but once we went through it and I was able to use the reflections and the open questions to guide her and lead her to her own arguing against herself that wasn't a good idea, then I was able to have more hope, and I was able to express that to her. And so what I was able to say is, I just want to kind of put out there for you what happened here. You came in saying that you were going to do one thing, and you're leaving with a better idea and a better knowledge of why that initial decision wasn't a best decision that you could make. And so I was able to express my hope and my belief that she was capable of change. So good stuff there. And then you want to focus on the small changes. There's no way that, and I've not ever seen this in my career, where someone comes in one day and an hour later at the end of our session they've made all the changes that they need to make. Changes are small. It takes time. A lot of times people are changing entire lifestyles. Sometimes they're making smaller steps than that, but change is hard, and I always have to remember any change that I've made, whether it's something that I've needed to do in my life or not, has been difficult. So focus on the small changes, make sure that we affirm those small changes, and it really supports the self-efficacy, that people start going, oh, I am capable of change. I am capable of this. Look what I'm doing now. I do a lot of training around motivational interviewing, and one of the things I do is a 2-day training. And when I do the two-day training, I always break people out into small groups, and one of the things I do is have them interview each other around real issues. And so I remember this one particular lady talking about needing to save money, and that was a real struggle for her and her family, and she didn't feel like she did it enough, and so forth and so on. And when we interviewed her a little farther, we learned that the past 3 months she had actually taken a car payment that she no longer had, that had ended 3 months earlier, and was putting that car payment into a savings account for the past 3 months, and acting like she didn't have that money that she didn't have before that she has now. And so we focused on that small change and about that she was successfully keeping to that 3 months in a row. It was a great. She didn't even recognize it until we pointed it out. What she said she had been doing. It's just like, wow, that I didn't even recognize that. That's the kind of thing that really helps clients as well, where you start pointing out things that they take for granted, and they go, oh well, I should be doing that anyway. But let's point it out and really share with people the great things that they're doing for their lives. Okay. Next, the part when I gave you the definition of MI, one of the things I pointed out is that it's directive. It's a little, it's Rogerian in that you were really client-centered and client-focused, and we talked all about that. But now it gets to a point where you can really direct the conversation. You can really be directive in the way that you help somebody raise their awareness. And the way that we do that is through evocative questions. We're evoking something out of them. We're invoking the awareness. We're evoking the discrepancies. So here's a couple of ways, or a few ways that you can do that and be directive. First of all, ask them the disadvantages to the status quo. Things stayed the same. What does that look like? What's the disadvantages to change? What's the disadvantage to staying the same? You're really being directive in that you're asking them specific questions around the behavior change that they're looking at. So a lot of times what MI would tell you to do with this is to actually write these things down. And they have a 4 quadrant thing that you can look at, where you can put the disadvantages to the status quo, advantages for change, optimism, and tension. So you can put these 4 quadrants and really have people look at what they're doing. That's very helpful, and I always do that in session with people. And you're directing the conversation around this. And you really get to some really good, needed information, and you get the client to tell their story in a way that is going to help you in the future, and how you work with them and how you help them resolve this ambivalence that they might have around their behavior change. So disadvantages, advantages for change. How optimistic are they that they can actually do this change? So important. And I think, let me just check. Yes, I'm going to tell you how to do that in just a few seconds here. And then intention to change. I bet let's go back to the nurses on the side of the street that are smoking outside of their hospital. I bet if you asked any one of them, they would tell you that at some point in their career as a smoker that they have had thoughts of changing and stop smoking, and they've wanted to do that. But if you ask them how optimistic they are about actually following through with that, you might find that that level is pretty. And this is how we get to that, and this is why this is so important. So when you're eliciting change talk and you go through all the advantages, disadvantages of where you are, and you do the pros and cons and so forth, one of the things you need to pull out is what we call the IC ruler, or the importance/confidence ruler. And it doesn't say that right here, but that's what it is. It's the IC ruler. So importance/confidence. So the first thing you want to ask them is the importance. How important is this change that you need to make to you in your life? 1 through 10, that's what you give them. You even have them graph it. You can put it on a piece of paper. I always do. Again, I think visual is always good, and they get to keep it, and they put it on the refrigerator or whatever else they might want to do with it. But you have this importance ruler, and they say, it's this important. It's a number 8 for me to change this particular behavior. That's the I. That's the important. Then you ask the confidence. How confident are you that you can make that change? And without a doubt, almost always, that number is a lot lower. So people might find something very important to them, but lack the confidence to do it. So some other questions that I ask around this importance ruler is, if you were at an 8, instead of asking someone, well, what would make it a 10, you only go up 1 number or down 1 number. Never go beyond 1 number. So if they say they're at an 8 in importance, then what would it take to become a 9? So you ask them, what would have to happen? What particular events or things or thinking around what you're doing, what would have to change in your current situation in order for it to become a 9? Or even better, you might say, really, an 8's really high, so what makes it not a 7 anymore? What took it from a 7 to an 8? And then find out what's happened recently that might have motivated them recently to move from a 7 to an 8. 8's pretty high as far as importance, and sometimes it's not even that high. But just as an example, no matter where they land Only go one above or one below. Then you move from the importance part to the confidence part, and you do the same thing with that. So like I said, usually the confidence is a lot lower than it is important, and they give you a 4. And at that point, you would say, okay, let's try to make this a 5. How can we do that? Or what was it? It was a 3, but now it's a 4. So what's the difference there? Valuable information that I get from clients when I'm directing them in this exercise. Tells me, they tell stories. It's not a simple, real quick, I see ruler, now I got your numbers, let's move on. I can spend an entire session going into stories around what makes it an 8 and not a 9, and then I can develop a treatment plan from this as well. So it was a tool, the IC ruler, that I didn't pick up in motivational interviewing when I started practicing it immediately. And I regret that because I went a couple, 3 years before I ever picked it up as a useful tool. And now I find that I can't work without it. And it's one of the first things that I do once I understand what the goal is. Then I can move forward with the IC ruler. So I find that very valuable. The next thing is you have to identify goals. Like I said, first session, I want to hear their story. I want to collect all the data I need to collect for my particular agency, because we know we got to do that. But I also want to identify the goals. And then a slash there, it didn't end with just the goals, but the values. Values are really important. So young ladies who want the children back tell me that they value family. So we always go back to that. How is it your value of holding family this high fitting in with your present behavior, with where you want to go in life and what you want to do? Values really take us back to what's important in life and what people will look at and talk about in ways that is different than just talking about a problem. So in other words, if I don't know what my client values in life and what they want out of it and what is important to them, then how can I really help them towards behavior change? And it's so important to have the values / goals talk with them. If I don't do that in the beginning, then I just don't feel like I have a real leg to stand on as far as moving forward in any kind of sessions with clients. So I'd like to mention that on here on the Adobe Connect, you can see under web links, it says Motivational Interviewing. I'd really like to encourage people to go to motivationalinterviewing.org. So many tools on there, from articles to exercises to help you learn how to get better at complex reflections. 2-day trainings, 4-day trainings, all kinds of information. So be sure to check that out. Also, one of the things that I want to point out on the Motivational Interviewing website is this thing called a values card sort. And so they give you and provide to you this whole exercise around how to get at the values that our clients hold and how you can use that as a valuable resource in moving forward with them when you're trying to develop a treatment plan. Again, just many valuable resources for motivational interviewing. Well, this is where we are to the point of questions. And so would love to engage in conversation as much as we can over the next 15 minutes. Looks like we have a question. Do you move the client to look at deeper fears or beliefs? For example, the woman who was having a hard time not being with her child's father, would you see if she has fears about parenting, her childhood experiences, et cetera, or do you keep it more about behaviors and thoughts? That's a very good question. How deep do we go? Is this psychoanalysis, or is this more about the here and now? And the answer is remember that motivational interviewing is not the intervention. It's the style in which you use to get somewhere. So the answer is yes, you can go there. It's a matter of whether the client wants to go there and whether you want to use psychotherapy to go there with her. Maybe you just choose to use cognitive behavioral therapy intervention to assist her. But it really depends on the client, and it depends on what intervention you choose to use. Hope that helps. Okay? How young of a, next question is, how young of a child can this be used with? That's another good question. I tend to say that the child needs to be at least 8 or older, although I think little bits and pieces of it, like pros and cons and values and that sort of thing, can be used with kids as young as 6, 5, that sort of thing. But most people find that it works best with kids that are 8 and older. Okay. Next question. This seems great for clients with good insight or to develop insight. I'm wondering how this might be applied to clients with personality disorders where resistance is a major part of their pathology. Absolutely. I think that's what I was referring to with my struggles with people who had been in treatment with me for 3 or 4 years. Example, the woman who wanted her 8-year-old to make that decision. She was in treatment with me for years and years, and honestly, I think she got better, you know, but I don't know exactly. I think she made some better choices while she was working with me, but who knows where she is now or what she's doing. But she was able to develop the insight. I think I absolutely 100% believe that every client I'm working with knows the argument to both sides of the equation. So if they need to stop using drugs, they can tell you why they need to stop doing it, and they can tell you why it's difficult that they can't do it. I need to elicit that out of them. So in other words, everybody knows and everybody has the insight. Okay? Question? How would you translate this into group therapy? Great question. I use it in group therapy a lot. The difference is when I'm using it and I'm doing my reflections or asking my open questions, it's going to everybody and not just one person. And then the other good news is I get to facilitate the interaction between the two. So sometimes what happens is there's pressure that, you know, that expert stance and all those therapist robots I talked about. The clients tend to do that with each other. And it's interesting to watch the dynamics. And I get to sit back and just facilitate that and watch how that works. So absolutely, you can use it in group, and you should, and let the other clients do the therapist robot so you sit back and really use your MI skills. Can this be used for marriage counseling? I'll have to say that I have used it, but only on one partner, not together, not joint couples therapy. That might be a little difficult. I don't know that it can't be used, but I've just never done it. I've tended to stay away from it. To couples therapy completely. I prefer to do one partner and have the other partner see someone else. So I'm not as expert on that. Sorry about that. What is the lowest level of IQ? Would you say MI is not effective? Another great question. Not really sure. I think it's one of those things where you try it out and you see what works, because again, people are unique and individuals are unique, and there's no way to really necessarily know. But I do know that some people have reported to me that it felt like it just didn't feel right or feel good to work with someone with a lower IQ. But I say, you know, there's great things around MI that you can use, but maybe you can't use all the skills. Sometimes with like kids, for instance, when you do a lot of reflective listening, they tend to go, quit being a parrot. They start calling you out and saying, are you really, why do you keep repeating? You know, and this happens a little bit too with people with lower IQs. They just don't understand. And so I say it's about skill level. It's about you growing in this experience and understanding more how to use it and the timeliness of things. So I think you try it, see if it works out. If it doesn't, that's your cue to move to another strategy. All right, next question. Oops, I think I work in a low-income clinic. Many people I see have some drug-seeking behaviors, mostly linked to PTSD and depression. Anyways, the expectation of the providers is when they are sent to me is to cease the obvious behaviors, not usually the goal or even the concept to many of the clients' suggestions. That's exactly where I found myself every time I was working with a client who was referred to me by DCBS. And again, I started with, you're here, you're referred to me, your referral source wants one thing, let me ask you what you want. A lot of times they might say they want the referral source off their back. Okay, so tell me what it would take to get that referral source off your back. What do you have to, what are the expectations that they want you to abide by? And so I start with what they think their goal is, and what they say their goal is, which is to get them off their back. And we work from there. And it usually works out really well because they feel a sense of trust and that I'm listening and that I'm not trying to make the referral person's goal my goal as well, but that I'm going to work with them where they are with their goal. So again, it's just a matter of meeting the client where they are. Hope that helps. Next question. Oops. Been a hard time getting it to come up. There it is. How do we, I guess the question is, how do we interrupt, redirect for the folks that seem to use sessions to vent and don't really comfortably give you time to ask questions? I think the one I'm thinking of is afraid of the question I might ask. Okay, so basically, how do we redirect? I use summaries. I stop them and say, okay, I've been listening now for 5-10 minutes, and let me just summarize what I've heard. And then after you summarize, the most important thing you do next is the question. It's how important is that question you ask about the summary. So after the summary, so you might say, you have said this, this, and this. You've given us 10 things we could talk about today. But that's way too many, and there's just no way we would be able to accomplish anything if we tackled all 10. So let's pick one thing out of those 10 things that you want to focus on for the rest of the session. So I always use a summary. I let them vent, use the summary, and then start getting focused. Once I ask that question about what they want to focus on, then I might pull out the IC ruler or the pros and cons or the disadvantages to the status quo, and I try to ask those evocative questions. Hope that helps. What resources, what do you do to, oh, sorry, went back to the last one. What resources would you recommend for additional training or more intensive training in motivational interviewing? Great. Again, I think you start with going to the Motivational Interviewing website. Lots of information there, like I said, articles, there's training announcements on there, all kinds of resources that you'll really like. Would be great to read the book, Motivational Interviewing by Stephen Rolnick and John Miller. You'll like it. I think the best, though, is to talk with someone else who's doing motivational interviewing. And you work with each other and talk with each other about, I tried this, this is what happened, am I doing this right, that sort of thing. You get better and better if you keep talking to other people who are doing motivational interviewing. So if you could get a nice class, a workshop with a 2-day workshop to get you really educated in the concepts and everything, and then you just work.
Do we have any questions on the phone?
Then that'll help a lot.
Again, I'd like to ask everyone, if they would like to ask a question, please press star and the number 1 on your telephone keypad. Again, that's star 1. And there are no questions over the phone lines?
All right, well, we'd like to thank you, Ms. Gannon, for sharing that really important information, and thanks to all the NHSC webinar participants. And at this moment, we'd like to ask you to fill out the on-screen evaluation. Your opinion will help us further develop these webinars. Again, thanks for your opinion, and have a good evening.
Ladies and gentlemen, thank you for your participation. You may now disconnect.